What are some tips to help you get the most out of your physical therapy experience to make it the best it can possibly be? I'm gonna let you know. My name's Antonio and I'm a physical therapist assistant, and I've been working in this field now for 4 years, and a lot of times patients don't make the therapy the best use of their therapy. What I'm trying to say is they could have a better experience if they just followed these few tips. It will help make their physical therapy process a lot smoother. Tip number 1 is to be a good historian. Try to remember the details of the time when you hurt yourself, or when you initially had your pain, or whatever the incident was that is bringing you to physical therapy. Try to recall the events around that time. What were you doing? What day was it? What were you doing prior to it? And was there any recent lifestyle changes that has recently occurred? That will be helpful for the physical therapist to do a better assessment of how they could treat you if they understand the details of what happened. The second tip is to set goals. It's really helpful when you go to physical therapy to have a goal in mind of what you want to achieve from coming to therapy. So if the pain was stopping you from bending over and loading the dishwasher, that might be a goal, what you want to be able to do. Or maybe you can't reach into the top cupboard because your shoulder hurts. Maybe you can't sit in your favorite chair because your back starts to hurt, or you can't walk for long distances. If you have a specific goal of what your incident is preventing you from doing, that can be really helpful and guide the treatment and guide the care that is provided for you. The next tip is to follow through with your treatment sessions. I don't know why this is, but sometimes people think that they're going to be instantly cured the first day when they've been having this pain for the last 7 years. They just automatically assume it's going to be gone in one day. And so if it's not, they get frustrated or they leave and they don't continue going to therapy. And I don't advise that. It's kind of the same way of taking antibiotics. You don't take one pill and be like, all right, oh, I'm not better, oh, bummer. No, you have to continue and follow through with taking your prescription, then you'll be completely better. Same thing with physical therapy. You should finish your prescription and then see, at least give it a shot to rule it out. If it's not helpful, then at least you've ruled it out. But if you never give it the chance, then you'll never know if it's helpful. Tip number 4 is to be an active participant with your care. What does that mean? That means to participate with what the therapist wants you to do, whether that's your home exercise program, whether that's a stretch in therapy, whatever it might be. Take an active role in your recovery and you'll see much better results. If you put all the care on the therapist and you never take initiative for yourself, then you won't get as good of results as if you put your best foot forward. This can be really helpful too to decide what will be the best course of intervention for you. So if you never try the stretches that your therapist advised you to do, then the therapist won't know for sure if it's the best treatment choice. But if instead you tried your stretches and they were helpful, then you know you're on the right track. Or if you tried your stretches and they were not helpful, then the therapist knows to change something. But if you never try your stretches, then you're never gonna know what's actually helping or hurting you. Tip number 5 is to focus on your progress. Sometimes we can get in a really self-defeating mindset and we're only focused on our pain or our problem or issues, and it can be really negative and self-defeating. But if you can focus on the progress you're making, in the changes that are happening, all the good things, you'll come out a lot better. Sometimes it's like the person who has shoulder pain and they say like, oh yeah, every 3 seconds they're checking to see if it's still there. Well, if you instead don't think about it, go through your whole treatment session, do your exercise, do your stretches, and then come back and see, you'll have much better results if you just keep picking at the same thing that's bothering you. You feel me? Tip number 6 is to ask questions. Don't be intimidated or scared to ask your therapist why they're doing that stretch or why did they choose this intervention. It can be really helpful for you to understand why they're doing what they're doing, because it can help you understand and clarify what you're supposed to be doing for your home exercise program and what could be the best interventions for you to help you through this recovery process. So don't be afraid to ask for clarification or to understand a concept better. The last tip I have for you is give your feedback. Please share how your therapy sessions are going with your therapist. Let them know what's feeling better, what's feeling worse, what is your favorite exercise, what is your least favorite exercise. This will give the therapist a much better idea of how to kind of maneuver your next upcoming therapy sessions if you continue to give them feedback. If you never let them know that you're sore after a therapy session, they're not going to know to back off a little bit or to spend more time trying these stretches instead of these. But if you can give feedback, it will help your therapy session go much smoother. The last tip I have for you is to smile, even if you don't love it. No, like smile, laughter, it's all good. I think it's laughter is the best medicine, smiling is the best, being happy is the best medicine. What is the best medicine? One of those is it. So brighten up, okay? Thank you so much for watching the video, and I hope these tips can help you along your way. I really hope you have a really good recovery experience, and if you don't, then come to my clinic because I'll help you get better. Guaranteed. Thanks for watching, and I'll see you on another one. Peace.